Good morning. Dr. Benson Evans here, coming to you from Southern California. I want to talk with you about cancer. Cancer is a word that people historically have attributed a very negative concept to, and rightfully so. It is a disease that can kill. It's also a disease that can be cured and held in remission for a long time, depending upon your own personal circumstances. When I was diagnosed with cancer, I was given 6 to 8 weeks to live if I didn't have chemotherapy. And initially, I was very hesitant. I thought, well, I might as well just consider my life over and not bother with the chemotherapy. However, then after I reviewed it in my mind, I said, well, let's use this as just another experience. And that I did. With the help of my oncologist, I worked my way through very difficult chemotherapy and wound up in remission. And upon achieving remission, I thanked my oncologist for getting me there. He said, although I accept your thanks, he said, it was you who brought you to this stage. It was your positive attitude. It was your determination. It was you who made it. Now I am here almost 8 years later. I didn't look at it as a fight. I looked at it as, well, this is another blip in the life of Dr. Ben Evans. I'm going to handle it as best I can. I'm going to accept the diagnosis, and I'm going to do the best that I can. Please note here that my oncologist mentioned to me that there are many people who don't make it almost immediately because they are so fearful of the outcome of cancer and feel that they're going to die that they do, because they have a death mindset. And I didn't have that. I felt that I was going to accept it, as I said, as another day in my life, and that I would accept it as another experience. So what does one have to do when we are diagnosed with cancer? We have to make sure that we are in the best medical care that we can. We have to be comfortable with the medical professionals who are handling our illness. We have to make sure that we feel that they are competent, and if necessary, get a second opinion. It always helps. And then we go about the curing or getting into remission if a cure is not possible, that is necessary to handle our cancer. I choose today, again, not to look at cancer as a bad word. I look at it as a word that reflects an illness that I have, and that I'm just going to accept it and do what I have to do by the medical professionals who I trust. Very important to note that in order to achieve what you want to achieve, whether it's a cure or remission, that we have to be in balance with our mind, our mental and emotional position, as well as physical. I can't stress enough that we need to push ourselves to the limit without breaking ourselves. It's very important during the process of chemotherapy, radiation, whatever, to be in balance. And if necessary, seek professional help on a psycho-emotional level. I have counseled many cancer patients through their trial, and I have learned so many things. We are all different in the way in which we approach this. Some people approach it with complete capitulation, which is bad, and some people approach it with very, very strong determination, and I admire it. Even when we capitulate, it doesn't have to be on a permanent basis. Yes, I had my bad days where I just felt that I just couldn't do this anymore, but I allowed it just for that time, just for that day. So the moral of the story is we need to define cancer as a serious, life-threatening illness that can be overcome with the right medical help and the right emotional, mental, and physical approaches. Very, very important. My wish for you is that you handle your diagnosis in a very calm, a very strong, and a very successful way, which I know you can do. So I'd like to hear about your plights, your approach. Please, I welcome you to my site, drbensonevans.com. Message me, and I'll look forward to responding. With all the best of health, be well. Signing off, Dr. Benson Evans.